Welcome to the Deep Dive. We're going to do a deep dive today into some recent developments in medical coding and healthcare.
Sounds good.
I'm Manoj Balakrishnan. I'll be guiding us through all this. We're taking our insights from justcoding.com. Really interesting stuff going on. We got to stay up to date, right? I mean, these changes,
Absolutely.
they have real consequences for insurance reimbursements, healthcare data accuracy, the whole 9 yards.
Yeah.
So we're going to cover a bunch of stuff today. First up, new ICD-10 CM codes for eating disorders.
Okay.
Then we'll look at how to fight back against clinical validation denials. Those are always a pain.
Right.
We've also got an OIG audit. Reviewed some interesting things. Overpayments for mechanical ventilation. Plus, we'll talk about Medicare's new HIV PrEP benefit. They're expanding counseling and screening. That's great.
Yeah, good news.
And we'll wrap things up with a look at the 2025 OPPS proposed rule. Could change a lot for outpatient hospitals.
Definitely worth keeping an eye on.
So let's dive in, shall we? Starting with these eating disorder code updates. They've actually aligned the ICD-10 codes with the DSM-5 classification
Right.
for feeding and eating disorders.
Which is huge, I think, because the DSM-5 is like the standard.
Exactly. For diagnosing mental disorders, this alignment means the codes we use for billing, record keeping, they actually reflect the latest understanding
Right.
of these really complex conditions. I mean, this is a win-win, right?
Absolutely. For patients and providers, a more accurate diagnosis
Right.
leads to better treatment, more targeted, more effective.
So true. It may seem like a small change on the surface,
Hmm.
but it really does have a ripple effect throughout the whole healthcare system. Can you give us some examples of the disorders that are actually affected by this update?
Oh, sure. Several conditions are impacted. Anorexia nervosa, for instance, bulimia nervosa, binge eating disorder, also pica in adults, and rumination disorder. They all have more specific codes now to capture all these little details outlined in the DSM-5.
So we're getting better data, more accurate data, which should lead to better understanding and hopefully more effective treatments down the line.
That's the goal.
Okay, let's switch gears a bit. Let's talk about something that I think causes a lot of headaches for healthcare providers. Clinical validation denials.
Yeah.
I mean, you think you've coded everything perfectly and then, bam, denial.
It's frustrating.
It's incredibly frustrating. So how do we fight back against these denials? What does the article recommend?
Well, it all comes down to documentation. Really good, solid documentation. Think about it. You're a hospital administrator. You get a clinical validation denial. The insurer is basically questioning whether a service was medically necessary.
Right.
But if your documentation is crystal clear, it outlines the patient's condition, justifies the treatment plan, and connects it all to the right codes. Then you've got a really strong case, and that's where CDI specialists come in.
Yeah.
And coders, of course. They're like detectives, making sure the patient's story is told completely through the medical record. No room for doubt.
So strong documentation is like your shield, your armor
Yeah,
against these denials.
exactly.
Shows that the services you provided were truly necessary.
Okay.
Okay, let's move on to another important topic, compliance. The OIG did an audit recently on mechanical ventilation procedures. And, well, the findings were pretty eye-opening.
Weren't there?
They found a ton of improper payments, $79.4 million. It's a huge amount of money.
Yeah.
So what went wrong? What led to all these overpayments?
Well, the audit looked specifically at inpatient claims with MSDRGs 207 and 870,
Which are?
codes for mechanical ventilation procedures.
Got it.
And what they found was a lot of hospitals weren't meeting Medicare's documentation requirements for these procedures. Sometimes the documentation wasn't detailed enough to really justify the level of care that was billed, and sometimes they were just straight-up coding errors.
It seems like these were honest mistakes, maybe, but it just goes to show how important education is, ongoing education, and doing your own internal audits regularly to make sure you're in compliance.
I completely agree.
Because even small errors in documentation or coding can add up to big problems. Financially, I mean. Okay. Let's end on a more positive note, shall we? Medicare's got this new HIV PrEP benefit, and they're expanding it, which is fantastic news.
It is.
So tell us about this expansion and why it's such a big deal.
Well, PrEP, it stands for pre-exposure prophylaxis, is a medication that really helps. It lowers the risk of HIV infection.
Right.
But medication alone isn't always enough. Patients need guidance. They need support to understand how PrEP works and how to stick with the treatment plan.
Makes sense.
So CMS is stepping up. They're expanding the counseling and screening services that are covered under this PrEP benefit. Eligible patients can now get up to 8 counseling and screening sessions every year.
Wow, that's a lot of support. That's really going to make a difference.
I hope so.
It gives patients the information they need to make informed decisions about their health and to use PrEP effectively. It's a huge step forward in HIV prevention.
It really is.
Okay, one last thing before we wrap up. We got to talk about the 2025 OPPS proposed rule.
Ah, yes. The future is coming.
It's still early, of course, but this proposed rule could bring big changes to outpatient hospital reimbursement and compliance. What are some key areas that healthcare providers should be watching closely?
Well, there are a few things. For starters, payment methodologies, how payment rates are determined. For different outpatient services, that might change. Also, coding guidelines, those could be updated, which means providers would need to adjust their practices to make sure they're billing accurately.
And of course, billing procedures.
Absolutely. If those change, everyone's going to have to adapt to stay compliant with Medicare.
So the 2025 OPPS proposed rule, it's like a wake-up call, telling providers to stay informed, stay flexible.
And be ready for anything.
Exactly. Well, we've covered a lot of ground today. We talked about the new ICD-10 CM codes for eating disorders, how crucial it is to have really strong documentation to avoid those clinical validation denials. And we dove into that OIG audit on mechanical ventilation procedures. Plus, we explored the expanded HIV PrEP benefit under Medicare. And we even got a sneak peek at the 2025 OPPS proposed rule. A lot to take in, right?
It is.
But the key takeaway is this: medical coding and healthcare. They're always evolving. And resources like justcoding.com can help you stay ahead of the curve. Stay informed, everyone. Stay engaged and keep up the great work.
Well said.
Until next time on The Deep Dive.
See you then.